الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. يسعدني أن ألتقي بكم في هذه الندوة عن التدريب الطبي في بريطانيا. يشترك معنا اليوم إن شاء الله تعالى 5 محاضرين، أنا معك منهم. معكم حسام الدين عدوان، زميل كلية الجراحين في بريطانيا وفي أيرلندا، ماجستير في سيرجيكال ساينس في علوم الجراحة من يونيفرسيتي كوليج لندن، وشهادة عليا في التعليم الطبي، وزميل التعليم العالي في بريطانيا. الآن أنا الحمد لله رب العالمين الآن أعمل في تدريب تخصصي في جراحة السمنة وجراحة المناظير في تورو. معنا بروفيسور لوباني، محمود لوباني، ما شاء الله تبارك الله غني عن التعريف، زميل كلية الجراحين في الكلية الأيرلندية وكلية أدنبرا وكلية إنجلترا، بتخصص الصدر وجراحة الصدر والقلب. زميل متقدم للهيئة التعليمية العليا في بريطانيا. هو الآن إن شاء الله أستاذ جراح مع جامعة هل نيويورك الميديكال سكول، واستشاري جراحة صدر وقلب مع مستشفى هل الجامعي، وهو أيضا مسؤول عن التدريب الطبي في منطقة في بريطانيا اسمها يوركشاير وهامبر، وهي منطقة كبيرة في بريطانيا. ومعنا أيضا دكتور صالح رمان، حاصل على البورد الأردني وزمالة ممبرشيب في الجراحة العامة من الكلية الملكية في أيرلندا، وهو الآن بيتخصص في الجراحة الجهاز الهضمي العلوي في مستشفى يونيفرسيتي هوسبيتال في نورث ميدلاندز. ومعنا كيتي ملالو، هي ما شاء الله زميلة معنا في مستشفى في تورو، هي من متدربات في الجراحة، وهتحاول تعطينا إن شاء الله نبذة عن مرحلتها في التدريب وشيء إن شاء الله يعني يساعدنا كثيرا. ومعنا الدكتور أحمد الشنطي، أخصائي نساء وولادة ومتخصص في النساء والولادة، هو الآن في برنامج تدريبي في النساء والولادة، وأصلا من غزة، وإن شاء الله يعرفكم عن نفسه بالتفصيل لما يجي له إن شاء الله تعالى. طبعا هذا اللقاء سيكون يعني حنحاول نجريه بلغة، أغلبه حيكون باللغة الإنجليزية، وبالتالي حنعيد التقديم سريعا بالإنجليزي، ولكن حيكون في لحظات المحاضرين أو المشاركين في الندوة عندهم الخيار إنه يتكلموا بأي لغة يفضلوها في ساعة اللقاء. مدة اللقاء إن شاء الله تعالى 90 دقيقة، قد تزيد أكثر إذا وجدنا أنه في احتياج لذلك وإذا الناس عندها رغبة في جلسة نقاش فيما بعد. My name is Hussam Eddin Adwan. Welcome to this webinar. It's one of a series from PalMed UK, Palestinian Medics. I'm a post-CCT fellow, laparoscopic upper GI and bariatric surgery. And with us will be Professor Mahmoud Lubani. He is an honorary professor at Hull York Medical School in Yorkshire, consultant cardiothoracic surgeon at Hull University Teaching Hospitals, and training program director for Hamburg Cardiothoracic Surgery. He's also a member of the Specialty Advisor Committee for Cardiothoracic Surgery in the UK and lead on Caesar application. We have also Dr. Salih Rumman, Jordanian board qualified with MRCS Ireland, and he's an upper GI specialty doctor at the University Hospital of North Midlands. We also have Katie Malali. She is a graduate from UK. She's year 1 in core surgical trainee at Royal Cornwall Hospital in Truro, and we have Dr. Ahmed Shanti, who is a gynecology trainee in the UK. So welcome to this presentation. We are going today, hopefully, just rules and regulation for this. Please keep your microphone muted, keep your camera muted, and with the session we will talk about career pathways in the UK to start with, a bit of an introduction, and we will move from that into applying to foundation and specialty training by Katie, and then we'll also talk about working in the UK for a non-training post. We will have a little bit of a brief introduction with Ahmed Shanti about training in gynecology as a different example to the general training, and then we'll have good session with Professor Lubani about planning your progress and dealing with obstacles. There will be panel discussion at the end. If you have any questions, please put them in the chat box, and we'll try to organize an answer for them either directly or later on. We have your email. You can send your questions by email as well, when we try to work hard to answer these questions. Please do keep your camera and your microphone muted, except for the members of the panel. رجاء إغلاق الكاميرات والبصر والصوت. نبدأ. I will start for myself, and I'm going to share my presentation. Okay. So this is choosing a medical career in the UK. What do you need to know? We understand that there's a mutual need for coming to the UK. The trainee, they have their own need, their personal agenda, their personal development plan, their ambition, and their specialization in mind. And they also have their local needs, the people around them, the hospital that they're working in, the population they're working for, the place they would like to settle. All of this is part of the training. Equally speaking, in the UK, there is an extended ongoing staff shortage. The NHS is under severe financial constraints, which means they are unable to satisfy a lot of local trainees financially, or to reward them financially enough, and they are relying on plugging the gap by trainees from overseas. The training system is under constant configuration, and which makes local people quite unhappy with the system. A lot of people will just leave for a year out on sabbatical or a leave to allow things to settle. These factors do not affect people coming from overseas as much as they affect local people. Just to be aware, this is not an invitation to come to the UK. We're not trying to promote come to the UK. We're trying to give you an idea of how training in the UK could be, and how you can plan a better pathway for yourself from the word go before you come to the UK. We hope by the end of this presentation you have an idea what you can get and how you can maximize your learning and training adventure, and be able to provide the service you need locally if possible, or be able to fulfill your ambition, whatever it is. Working in the UK, there are several avenues for that. There's the national training program, there's the post-training fellowships, there are international training fellowships, and there are international training programs. They attract various types of visas. There are also various types of jobs, which we collectively call service providing jobs. Each of these programs have a specific type of visa, and we'll talk about it in a bit. In general, there are three categories of training in the UK. You can either train clinically through a training program, or through an alternative pathway, non-training program, or just a fellowship, or you can combine training clinically as well as academically through a recognized training program, or called academic training, or through a time out of training, if you are in training. Or if you're doing a fellowship, you can add to that joining a university or planning for a degree while at work. And there is pure academic, it depends what specialty you are. So if you're a histopathologist, or if you are a scientist and would like to pursue just research kind of avenue for education, you can also achieve that separately. The pathway in the UK is a bit complex, but to simplify it, the medical school here could range from 4 to 6 years. There is a specific program called Graduate Medical School Program for people who already achieved a university degree and they would like to pursue medical career afterwards. They go into special enhanced medical school of 4 years, and the standard medical school is 6 years. After medical school, you have to go into a foundation year training, which is equivalent to an internship in our country. But in the UK, it's 2 years of training. Every doctor graduating from the UK or the world has to pass through an equivalent, the foundation training itself, or an equivalent training. After that, the pathway can diverge. You either go into a run-through training or a GP training or run-through training or a specialty training, or do you just decide you don't want to go through a training pathway and you want to go to a non-training pathway? Now, ultimately, the training pathway should lead you to what we call a certificate of completion of training, CCT, or a GP registration. The foundation training is a 2 years of 4 monthly rotations. This can be themed, that is surgery, medical, ENT, whatever specialty. If you have something in mind, you can negotiate making it a themed approach. It is equivalent to internship training. Be aware that if you have finished your internship overseas and you want to come to the UK and you've already started some training, you don't have to go through the foundation year, but it's a pathway. You can do so if you want. You can start by year 2 of the foundation, or start from the beginning, or you just, if you manage or can provide a certificate to say you've achieved that kind of training, the same training required, then you can progress to the next stage. It can be a run through the whole 2 years, or you can do a year of the 2 years, or you can do what they call a trust doctor at that particular level, foundation year doctor level. It is required for all doctors either to do the actual training or to provide the certification or a document to state that you've done that kind of level of training. There is an application window that you can apply from overseas as well, and the application window starts for various types of programs within the foundation program from July, and normally it closes in November. This year it has been extended to January. The national training program is generally speaking, goes under 2 types. It goes under what we call a coupled or uncoupled. The uncoupled is basically you have to do, after your foundation training, you have to do what we call core training. That could be core surgical training, core medical training, depending on the specialty you're in. And it's equivalent to the previous nomination, SHO, Senior House Officer. You do 1 or 2 years if it's surgical specialty, up to 2 years. And if it's a medical specialty, you can do up to 3 years, depending on the specialty you're applying to. You don't have to finish 3 years if you with certain subspecialties, but some subspecialties require the completion of 3 years and core training. Then you move to the next stage, which is a specialty training. I'll go to that in the next slide. The coupled, which is a run-through program, you start immediately after you finish your foundation training. You apply, and if you're accepted, you'll have a run-through of from 1 year to 8 years, up to 8 years in total, to finish your training and to get your specialization. And some specialties offer this, such as general practice. This is the shortest training in the UK currently, which is about 3 years. Gynecology and obstetrics, ophthalmology, neurosurgery, and cardiothoracic surgery surprisingly offer both. And radiology offer also a run-through training as well. You can see from this slide how it varies by specialty, whether you can do a coupled or uncoupled training and what is required to move forward. Generally speaking, the training in the UK takes in total, after foundation training, can be anything between between 3 and 8 years in total, and depending on the specialty you choose. From this slide, you can understand what I mean by the run-through post ST1 to ST8 or 7, depending on the specialty, or a core training CT1, 2, or 3, and then you move from ST3 to ST7 or ST8, depending on the specialty. As an IMG, as someone who's coming from overseas, you can actually come and apply to any points of this. You can either apply as an F2, you can apply as a CT1, CT2, you can apply as a ST3, or you can apply to the run-through training program. You can do that from overseas if you manage to fulfill the requirement for application. Service posts have a wide range of nomenclature for it. It can be called, when you look for a job, and there are a few websites to advertise for jobs, the BMJ, the NHS Jobs website, Track website. They're generally advertised as Trust Doctor, SAS Doctor, Staff Grade, LAS, Locum Appointment for Service, and they're going less and less in that category. Trust Clinical Fellow, the clinical fellowship, the various names, senior, junior, clinical fellow, but they are not approved for training, specialty doctor, trust registrar, bank doctor. So the clinical fellow name, you need to be very careful about it. If you are actually thinking it's a fellowship, you need to look for the recognition. Is it recognized by Royal College of Surgeons, or can it be recognized by Royal College of Surgeons? And there are other training posts, and again, it's a different nomenclature when you apply. When you look for a job, it can come as a LAT, locum appointment for training, training fellowships. These are approved training fellowship posts in various specialties. If you're doing breast, for example, you find a TIG training, a specific training for breast with a specific title. The training I'm doing post-CCT is a recognized training by Royal College. It's specific for a specific period of training. Specialty training fellowships. International training fellowships also is a system. We'll look into it in a bit. International postgraduate training, deanery, and international surgical training. Now, all of the last three, they're actually part or a variety of the medical training initiative introduced in the UK in 2009. This is a short video about the MIT. I will share with you briefly. It's a 3-minute video.
So I'm Shona McGlynn.
Hi, I'm Ninette Premdas.
And we manage the medical training initiative here at the Royal College of Physicians of Edinburgh. This film will tell you more about the programme and how it could benefit you.
We're always keen to hear from interested trainees from outside Europe and also NHS consultants with unfilled training posts. So please do get in touch if you're interested in what MTI can offer.
The Medical Training Initiative, or MTI scheme, is all about giving the opportunity to international medical graduates to spend up to 2 years in the United Kingdom working in the NHS, where they will get supervised training by the Royal College, the deanery, and the consultants, and they'll have the opportunity to acquire new skills and new competencies which they can take back to their home country. For trainees, there's great benefits in that they can attend both local and national training courses. But more importantly, they can make new friends and also make contacts which they can take back to their home country and have collaborations for the future. For the NHS, of course, the great benefit is their service to the NHS to help us deliver good healthcare to our population. But they can also bring some aspects of their care to the UK.
We had a gap in our specialty training rota that we could not fill through the UK recruitment process. We approached the college MTI team, and really the college did everything for us. They were able to arrange interviews, they were able to arrange all the paperwork and permissions. Overall, we found it a very positive experience, and the whole logistic process was absolutely seamless.
Certainly, I would recommend the MTI to other doctors because it will offer them a great chance to develop their experiences and their skills, which they could implement in their home countries when they return back.
The Royal College of Physicians Edinburgh ran the program in such a way that it's focused and tailor-made to the needs of the trainee. And at the end of the program, you'll be able to get training that will be relevant and applicable to your country of origin.
It is an opportunity for me, coming from Malaysia, to be able to improve my skills. And it's also important to know that the NHS recognize a balance between work and life.
In my case, I have the opportunity to train in a first-class environment in medicine, at the same whilst learning a new culture and also getting a salary.
I would recommend MTI to other doctors because it is really very beneficial for their future career, and also they can gain a lot of professional experiences and gain a lot of skills and experiences so far.
If you're interested in MTI and you're a postgraduate doctor, visit the website, look to see if you're eligible, and if you're in doubt, make some informed inquiries to the college.
The MTI program appoints people from around the world. Apparently, the Foreign Ministry, the visa section, have allowed up to 1,500 MTI doctor to come to the UK, and that number has never been achieved. So there is plenty of that. And the recognition of the MTI can be either the Royal College advertised for it, or the hospital advertised for it, or the actual trainee identify a position that you would be interested in, and then communicate with the Royal College and the hospital to make it recognized prospectively before they start. So all these options are possible here. There are a difference between tier 2 and tier 5 visas you need to be aware of, which in terms of employment, tier 2 is dependent on a firm offer from a UK trust. It can continue being rolled over annually, requires BLAB if no appropriate qualifications, and tier 5, a Royal College sponsored post matched to the candidate exempt from BLAB exam is a 2-year maximum. The induction is normally local when it's tier 2 visas, and the other in tier 5 with the MIT is by the Royal College itself, and the training is supervised when it's coming with the MIT, rather than you might come for a service job in tier 2. The GMC registration has, you need to be aware of this is the General Medical Council registration for the UK. Every applicant needs to have a certain level in the IELTS exam. Please keep up to date with that. It can keep changing. There are several routes, including the BLAB exam, the specialty exam, MRCS, MRCP, the recognized training at international boards or training exam overseas, such as the European board is recognized to my extent, to my knowledge, and tier 5, as we explained earlier. Once you're registered, you have to keep renewing the registration, and that's through annual review of competence and progression, ARCP, if you're in a training program, or annual appraisal if you're not in a training program, or if you're in a fellowship, and revalidation every 5 years. There are types of registration you need to be aware of. Registration without a license. So if you are doing a university degree and you don't have any clinical commitment, you can, if you want to join the GMC, this is the way to do so. Or there are registrations with license to practice, and that can be limited registration, provisional, or a full GMC registration. There are specialist register or GP register, and these two are the result of applying through completion of certificate of completion of training, or certificate of equivalent specialty registrar training posts. Planning, you need to decide why you want to come, for how long you want to stay, and what's your career intention. The clarity of that plan, the clarity of that decision will dictate what you would like to do and how you'd like to proceed. You need to start your inquiry early, online search, identify local authorities or hospitals involved. There's a list of those on each website you look for if you're surgical or medical, and ask friends, ask Palmed. Warning, there are things you need to be aware that the things that's constantly changing: the curriculum, the training structures, the assessment and goalposts, the job market, the political narratives, why we're doing what, why we're bringing people, the NHS requirements or needs, and the application requirements, they keep changing, and we're going to go into this in a bit. And finally, tips: start early, be flexible, aim for a good training post. You can get it, and there's a huge demand, and there's plenty of good jobs. You need to be, you can be selective, you can afford to be selective. Do your exams early, do your exams before applying, read the job adverts carefully, and read the contract carefully. We will postpone questions to the panel afterwards. Thank you for joining. I'll stop the sharing. And can I invite Katie Mullally to give her part about the new changes coming into the examination, which is related to training as well, and we'll take it from there. Katie, if you don't mind taking the lead.
Yeah, of course. I'm just going to share my screen now. There we go. Share. Can you see my screen now?
Not yet.
Yes?
Not yet.
Oh, sorry. Sorry, one moment. Sorry, it's making me activate something. I'll be 1 minute. Do you maybe want to answer a question? It's making me do something on my computer before I can share my screen. Do you want to answer some questions? I'll mute myself. And
if you want a few moments, I can ask Ashanti to give his presentation straight away, and then we can come back to you in 4 minutes. What is all this?
Yeah, that'd be fine.
Oh, Ahmed Shanti, are you around?
Yes, I'm around, yeah.
Can you put your presentation up, please? I'll come to you. Your presentation will complement his presentation very nicely.
Is it all right, Hussam, if you can, I've sent you the slides. Can you share it from your side?
You can't share it from your side.
No, can you share it from your side?
I can try, yes, give me a second.
Okay. While you're trying, I'll introduce myself. I'm Ahmed. I'm Ahmed El-Shanti. I'm a medical graduate from Al-Azhar University in Gaza. I graduated in 2016, and then I went to the UK to get my Master of Public Health in Sheffield. And after this, during my master degree, I got my GMC registration, and I spent 2 years working in non-training jobs until I get my training in Obs and Gynae. I'm currently working as an ST2, Obs and Gynae training in Hull Teaching Hospital, the same hospital Mr. Lubani is working on. Thanks for sharing. Just to double check, is my voice is clear and presentation is there?
I can see it. I don't know about others.
Excellent. So to start the presentation, the next 5 minutes, I'll try to elaborate on mainly 3 points. And the first point, how to enter training in Obs and Gynae and the process of application. And the third point is to what is the advantage of the subspecialty training in here in the UK, why you should take this major steps in your life to come into the UK. Is it worth it or not? So first, I will start by briefly elaborating what is the Obs and Gynae training here. So it's 7 years. So I want to throw, as Hussam has explained before, and during the first 5 years, you spend it in generic Obs and Gynae, where you've been taught all the Obs and Gynae stuff in general. And then the next 2 years, after the 5 years, you'll spend it in subspecialty training, or you can go for a more generic approach to the training by going for the Obs and Gynae, both of them, rather than going to a specialized area. And to get into the training, there is 2 points of entry. Most people go in ST1 training, which is year 1, and you don't need any experience or do any exams. You just apply for the training and you start from year 1. Or if you have more experience, like more than 2 years experience, then you can apply for ST3. However, applying from year 3 requires as well, you get some MRSOG part exam, part 1, you get to have some experience before you apply for ST3. But the hope is not just there is still a hope for people who have finished their training in outside and become a specialist. They can come to the UK, and as Hussam has explained, they can work in service job and go through the CSER pathway and then become a consultant. A Royal College Obstetric and Gynecology encourage people to pursue the CSER pathway, as there is a massive shortage for the consultant job in Obs and Gynae as well as any other specialties. So how to apply? So we said, if you have less than 2 years experience, apply for ST1. If you have more than 2 years, apply for ST3. But you have to get the MRSOG exam, which is our fellowship exam, part 1, before you apply for ST3. And anyone who wants to apply for ST3, I'm more than happy to help them through the application. So how to get to the training? So you got to apply for as any other training, as well my colleague Kate will explain. It will be a similar process. The first thing you need to do is fill the application. And the applications for training are all in the Oriel website. And then second, you need, after applying for the training, you get an invitation to do an exam, which is like a selective exam. And if you get a high score, they will invite you for an interview, and then they will mix the score from the interview with the score from the exam, and then they will offer you a training. Obs and Gynae is fairly straightforward applications. It's easy, it's not difficult, and the competition rate is kind of average. So you still kind of get a chance of getting the training rather than going for like a very more competitive trainings like neurosurgery or something else. Can we go to the next slide, Hassan? So after we said that, what is the training and how you get to the training and how you apply for the training, what is special? Is it worth it to come to the UK and take all the efforts to be trained here? The answer is simply yes. So the training, the subspecialty training here in the UK is one of the most highest quality training all over the world. You get to have a very high quality training. You get to use the most recent diagnostic tools, and evidence-based medicine is everywhere in the practice as well. You get to use a more sophisticated, innovative ways for treatments. For instance, in gynae oncology, you get to use very, very advanced diagnostic tools to detect ovarian cancers, and you can, as well in the treatment itself, you get to use robotic surgery. Right now in our hospital, they use robotic surgery to do a total hysterectomies and as well oophorectomies. So it's a very, very interesting, and as well in fetal medicine. So it's not really just a scanning for more complex fetal issues. Right now we have a very sophisticated diagnostic like amniocentesis. We can use right now treatments for in utero, like do a fetoscopy or do, for instance, a laser ablations for a transfusion syndromes. So it's a very, very interesting and very exciting. And once you have these skills, you can carry it everywhere and work. You'll always be in demand if you've been trained in the UK. Urogynecology, for instance, is a specialty I'm looking to be in. Hello, Hassan, there is someone.
Can we please unmute everyone, please?
So, the urogynecology, which is the specialty I'm really looking forward to apply, finger crossed, dealing with a very complex vaginal prolapse cases, urinary incontinence, is the cases which is difficult to be treated in normal centers. You get to be, when you're on subspecial training, you get to have the skills to deal with them. So the last thing, and Sam, go to the last slide.
I moved the last time. I thought you mentioned it already. I stopped the sharing.
The opportunities.
Okay, I did. I thought you discussed it already. I'll share it again.
The last one, yeah. So
this one.
Yeah. So the last slide is about if you still don't want to come to the UK for training, there's still opportunities for you as well to learn what is being taught here and how as well learn the new methods and diagnostic tools and how to approach patients and all this clinical stuff through the Royal College websites. There is a very, very, very good clinical content hub in the Royal College websites. You can just pay about like $140 or something in a year. You can get access to a very, very large amounts of learning materials that trainee here in the UK use it. As well, there is the last thing which has been explained by Hassan, which is the medical training initiative. It's still applicable in the Obs and Gynae. Actually, there's one of the MTI people who come in from Sri Lanka about last month to be trained here for about 2 years and then go back to Sri Lanka. I think this is a really good, nice method to come in here and receive some training, and one of the highest quality trainings in the world. Thanks, everyone.
Thanks a lot. Katie, are you ready?
Yeah, I've sorted that issue out. Sorry about that, guys. I had to change some security settings on my laptop to let me record.
If you need, I can share it from my side. You're sharing. Excellent.
No, I've got it. Lovely. Okay. So as Hussein was saying, we work together in Royal Cornwall, and I'm one of the core surgical trainees. Pardon me. I started this year in August, so I've only just started the training. I've really recently gone through the process of applying and getting into core surgical training, so I thought it'd be good to talk to you guys about it while it's all kind of still fresh for me. So in terms of where I am in my training, so this is a diagram very similar to the ones I've seen in the previous presentations on the slide. So in the UK here, medical school, I went to medical school for 6 years, and that's because I took a year out to do a separate degree, my BSc. And then 2 years of mandatory foundation program, which I did in Liverpool. I then took a year out to do a junior clinical fellow job, spending 6 months in breast surgery and then 6 months in A&E. And during that year out, I applied for core surgical training, which I got into, which I'm doing now. So I'm a CT1, next year I'll be a CT2, and next year I'll be applying for ST3, which will be surgical registrar and general surgery. So that's where I'm up to at the moment. In terms of applying for core surgical training, quite a lot has changed between last year when I applied and this year. So one of the biggest changes is the introduction of the MSRA exam. So obviously I haven't done this exam because I applied last year, but I've got quite a few friends who are applying this year who are kind of undergoing their revision at the moment for this. So I do know a little bit about it. So previously, how they selected people for interview for core surgical training is you performed a self-assessment, which we'll talk about a little bit later on. And they used the top 1,100 scores from the self-assessment to decide who would be interviewed. However, instead, they're changing this to the MSRA exam, which they're using in quite a lot of specialties in the UK at the moment. I think GP definitely use it, radiology might use it. There's a few. So it stands for, I've taken off what it stands for, multidisciplinary something exam. It's 170 minutes long and it's kind of split into 2 sections. So there's professional dilemmas, which is SJT style questions. I don't know whether you guys do an SJT, but that's situational judgment test. So the classic question will be, you're working in a busy general surgery department and your registrar comes in and you think you can smell alcohol on him or her. How do you proceed? And there'll be 5 options and then you rank the options in order of appropriateness. And in terms of how it works, the most and least appropriate are normally very obvious in that most appropriate, you take your registrar to one side and explain your concerns and discuss them. Least appropriate, you out your registrar for being drunk in the middle of the handover and call the GMC. And there's loads of question banks and stuff you can do to help prepare for this exam. And then there's 75 minutes of clinical problem solving. So these are all questions based on clinical situations. They're all quite heavily UK guideline based, so NICE guidelines. And there's loads of question banks that you can use to help prepare for this exam. And there's also, I've included a link here. I've been told this link doesn't work, so I'm going to change that to the slides that get sent out to you all. But there's really comprehensive guidebook that it'd be good to have a little read through before you start that exam.
Katie, I'm sorry to interrupt you. Can I ask if you just, because a lot of people don't know the abbreviation. So the first, just if you mention what MSRA, I think it's a multi-specialty recruitment assessment. Is that what it stands for?
Yeah, I think that's it, exactly.
And
I thought I'd included that on the slide.
Yeah.
So.
And the NICE guidelines is the National Institute of Health Quality Assurance, something like that. I can't even remember.
Yeah, exactly. Sorry about that. It's just because we use those abbreviations every day. I'll be mindful of my my abbreviations going forward. And then SJT is the situational judgment test, as I said, and SPR is just registrar. So as we were saying before, we apply via the Oriel system. That's the link there. Relatively straightforward system, just kind of putting in all your demographic details, qualifications. It's very straightforward and it talks you through it all. In terms of what's going to get you the interview, it's your MSRA score. That's going to allow the people to shortlist for interview. And then there's going to be a self-assessment score, which we'll talk a little bit about on the next slide. And then there's the interview score, and the majority of your points for core surgical training come from your interview. So this is the thing that you really need to be practicing a lot with. And what I found the most helpful was practicing with a buddy. So I had quite a few friends that were all applying for core surgical training, and we'd all get together and practice interview scenarios. So self-assessment scoring, this is the document that you need to know inside out. So what I did, as soon as I knew that I was applying for core surgical training, I printed this off, highlighted all the important bits, and I had a post-it note on each section of this, and it was basically a to-do list for myself that had jobs from each of the following sections that we're about to talk about. So it's broken down into several sections and you get points for each section. So for as you can see on here, to score maximum points in this section for operative experience, you need involvement in 40 or more cases, and that needs to be on a verified logbook. So I'm sure if you're interested in surgery or thinking about doing surgery, you've already got a logbook, but if not, definitely create yourself one. Even if you're just thinking about surgery, it's worth creating one. Start getting a log down on the operations that you're assisting in. It's quite easy to rank up 40 or more cases, especially if you kind of take some time beforehand, before you apply to specialty training, to get that experience and to be sure that you want to do surgery. And it just needs to be signed off by a consultant. And again, it's really important to read in the document that was on the previous slide, to read it all carefully, because all exactly what they want, the evidence they want in the format they want, is on there. And I know lots of people that lost 8 points, for example, in this section because they forgot to put a date, like write down a date. So just read it really carefully and stop yourself making silly mistakes like that. So I'm just going to kind of whiz through these slides, because you're all very capable of reading and finding out what you need to do to achieve max points. So attending 3 surgical conferences. So these are just conferences that are approved, and there's a list here of just an example of some. Online ones count, so if you can kind of get stream into one, they count as well. And big comprehensive list of these on the Royal College website, and you just need a certificate of attendance for your evidence. Surgical experience, you just need a consultant to sign to say you've done at least 6 weeks in surgery. You just need a kind of letter-headed paper with saying what you've done, consultant signature, date on there, print their name. Audit and quality, sorry, QI here stands for Quality Improvement Project. So one of the top tips I would say for your audit project is it doesn't have to be anything exciting. Obviously, it's great if it's exciting, crazy, groundbreaking audit or quality improvement project. But if you're just doing a very simple project on whether surgical patients are getting their Delta-Parin when they're being clerked, then that's a very quick, easy audit for you to close the loop on and get a quite easy set of maximum points in this section. So I would save the groundbreaking stuff for later on when you've got your training post, but if you just do a quick, easy Delta-Parin audit, close the loop on it, so make your change, repeat the audit, and this is quite an easy section to get full points in, I would say, and just make sure it's surgically themed. So as I said, in surgical patients. And then it's really important that you're presenting your audit, and you're going to be doing that anyway as part of making change. So for example, presenting it locally, regionally or nationally, and you kind of get more points for that. So this year they've taken some stuff out and they're really hot on you delivering oral presentations for research that you've done. So what my top tip for this would be is, if you've done research that you're proud of, even if you're not proud of it, if you've done research, send it to absolutely everything. Send it to ACIT, the Association of Surgeons in Training, and just send it to as many places as possible, because that's just going to maximise your chances of getting an oral presentation, getting a poster, and then obviously they rate publications very highly as well. So just making sure you've got your PubMed ID number and everything, you're not losing points on there. And then teaching, again, I think this is a really one that you can score max points on. Make a very easy teaching program for medical students, make it surgically themed, make it interesting, talk about surgical emergencies. I think it's very achievable that you can kind of score 10 points on this. And also, if you design the teaching program, you don't have to teach in it every week. You can recruit people to come and help you out with that. But if you've designed it and are teaching regularly in it, that's something you can very easily get 10 points for. And then your qualifications are kind of as you see there. So moving on quickly to talk about the interview. So the interview consists of a 3-minute presentation on a theme topic. So for example, mine last year was, please talk for 3 minutes on your leadership skills. So I think lots of people kind of talk about leadership within work. Quite a classic one I heard lots of people talking about was kind of, oh, I led a cardiac arrest, things like that. My top tip for this one would be, think a little bit outside the box. The people who are interviewing you are going to listen to so many presentations that day. You need something a bit exciting on there. So for example, I spoke on my presentation, I'm really into rock climbing, and I spoke for 3 minutes about how I demonstrated leadership in traditional British rock climbing and how this translated to surgery. So I'd kind of make a point about rock climbing and bring it back to surgery, and I got full marks for my presentation on my theme topic. And then they give you 2 minutes of fairly generic questions, and again, there's loads of question banks like this MediBuddy one for you to sit down with a partner and just practice loads. You've got a 10-minute management scenario, which is tends to be ethical. So, for example, similar to the situational judgment test, your registrar smells of alcohol, what do you do? And then you've got 2 clinical scenarios. So my clinical scenario was I was referred a patient with by A&E who was query renal stones, and who turned out to be a ruptured AAA. And then I had a clinical scenario that was a trauma scenario. I had to do a primary assessment, and the patient had a cardiac tamponade, and I had to kind of discuss what the management options for that would be. So in terms, and I think this is my second to last slide, sorry to keep you guys. So in terms of changes to the ST3 application, so obviously I'll be applying for ST3 next year. So this isn't my kind of area of speciality, but I just thought I'd bring it in just because it's something that has changed. So what has changed is that you have to have completed your MRCS Part A, which is your written exam, and your MRCS Part B, your OSCE exam, by the offer date, which means that really when you start your core surgical training, when you're in the point that I'm at, you need to get your exams done straight away, which I'm working on. I've got my exam in January. So that's one of the main changes to the ST3. So I think we're going to do questions at the end, but I've included my email address here. Please feel free to email me any questions. I'm happy to help out in any way I can or answer any questions you don't feel have been covered on the presentation.
Thank you very much, Katie. Just a quick question. What is OET?
No problem at all.
That's something you've used in your application. What is OET standing for?
OPT.
OET. Did you mention something?
Sorry, which slide was that on? OPT.
OETT.
Oh.
I think OET stands for Occupational English Test, which is a required test for the GMC registration.
I think different things. Well, thank you very much indeed. Now, thanks, Katie. Thank you, really appreciate it. Just
no
to if you have any questions, please feel free to put them in the chat, and we'll try to answer them at the end. Planning takes time, as you can imagine. If you plan to come to the UK to do a certain training, you need to plan it a year in advance. I will give the presentation next to Salih Rahman if he's around. Salih, are you here?
Yes.
So we will have, if you can run through for the next 10 minutes with your presentation, and then we'll take it to Professor Lubani.
Yeah.
Salih is currently doing a trust doctor, a specialty doctor post. You can introduce yourself about it and tell them all about your experience, please.
Hi, is my screen shared?
Yes, I can see it.
Yeah, so my name is Salih. I've been in the UK for 15 months. I've started somewhere else as a specialty doctor. Then I moved to more subspecialized upper GI HPB service in the University Hospital of North Midland. So just talk a quick presentation about some tips I've been through and been advised from my colleagues when I came to the UK as a non-training surgical doctor. So usually when you apply through the track job, you might need to apply as junior level or as a senior level. And as Dr. Hussam said before, there are different names for the junior level, but you have to be careful if you want to apply for senior, and sometimes you might misjudge the advertisement, because sometimes it's not very clear whether it's a senior job or a junior job. So you have to be careful. You have to read the job description that is attached to the advertisement and look to the salary. Most of the time, those both things you like will be very helpful to check if it's a junior or senior level job. And why some people, or do you want to go as a junior level when you go to the UK? Either if you have no previous experience, or you have previous experience but you want to go for a subspecialized or subspecialized specialty, or like pediatric surgery, vascular, plastic, or other subspecialties, because sometimes it's very competitive to go as a senior. So you start as a junior, then you get more experience, then you apply for another senior job. Or if you want to go for specialty training, it's helpful to understand the system as a junior, then build up your portfolio before you apply for senior jobs. And most of the time, the prerequisites for a junior job is just you need to have the GMC through either the PLABS or the MRCS. So and also, as we said before, when you apply for a senior level, there are different names like senior training fellow, senior clinical fellow, staff grade, SAS doctors. Why you need to apply for this? Most of the time, when you come to the UK, you need to go for a non-training job in general. So if you are quite senior, it's good to apply for a senior job. And what are most of the our colleagues apply as a senior, and their goals either to get focused experience for a couple of years, then go back to their homeland, or they want to build up their portfolio and to go for a consultant. There are different pathways to get a consultant certificate, either through the CCT or the CSER pathway, which is a certificate of eligibility for a specialty registration. And some people choose a stable life, so they go for a long-term career plan, like specialty doctor. Will explain that in a bit, because it's not difficult to get the specialty doctor, and you don't need a lot of certificates to get that job. And sometimes it's beneficial to get like stable substantive job if you want to stay in the UK for a long term. Also, you need to have your GMC by the MRCS, Part 1 and Part B. There are a different route. Also, it's been mentioned briefly about the MTI, which is like a specialized training scheme. I know a couple of my friends apply through that scheme. It's for international medical graduate. When you apply for it, they will give you a Tier 5 visa, which is a visa for 1 or 2 years, and you will not be able after that to, or you will not be candidate to get the ILR after that. You have to be careful about this scheme because it's unpaid. So, and sometimes you don't need an MRCS, but it's become more competitive. So you will need some centers or some trust, they require you to have MRCS Part A and Part B. The most important thing if you want to apply for the MTI, you have to get sponsorship with acceptance letter from the university hospital you want to apply through, because it's unpaid. So you have to get a sponsorship letter, entail that you are, they will cover you for this period, they will pay your expenses. How can you apply to the MTI? It's either by track job. If you get shortlisted, then you can ask for that if you get a sponsorship letter. Or you can send email to the lead consultant on track jobs. So if you apply for example, pediatric surgery, you go to the email the consultant or lead consultant, and you send them an email that you are interested as an MTI scheme, and you get that letter. They might accept that. Also, you might email the Royal College of Surgeons. They have different programs. They might give an advice to you. And I think the most important thing is to ask somebody before who applied to that MTI job, because sometimes if they finish and you know about that person, they might help you to be the second after. Just brief about the CSER pathway. There is a new criteria to entry. So if you want to be a consultant through a non-training job, there are different pathways to the surgical, medical, and other specialties. So especially for the surgery, there is a new criteria. It will start from next year, 2023. We don't have to go deeply, but just to be aware, if you want to apply through to be a consultant through non-training pathway, there is a way, but you have to do a lot of paperwork. Also, this been discussed before regard to build up your portfolio. An important thing, when you come to the UK, you have to think early. What's your plan? If you had previous experience, any previous board, medical, surgical, etc., you have to think what you are planning. If you want to stay here for a long term, you have to be careful. What do you want to choose? And you have to understand all the circumstances from your career pathway, your family pathway. So and you have to to plan ahead of that. So if you are still junior, and I advise to go to the training pathways to get your the highest hierarchy job, which is the consultant job. But sometimes if you had previous experience and you want to stay, sometimes it's worth to think about the SAS doctors or specialty doctor, because you might get a substantive job in a good place with good experience, with good duties to do. So and I've known also a couple of my friends who yeah.
We are going to talk about this in the panel discussion, so we'll leave this to the panel discussion.
Yeah.
I would say we'll talk about the pros and cons. If there's anything specific, brilliant. If not, we'll talk about the pros and cons at the end in the panel discussion. We'll leave it to questions.
Yeah, that's fine. What else? Yeah, the cost for the in general when you apply to the UK, I mean my the surgical aspect. When you the MRCS Part A and Part B, it costs around 2,500 to 3,000, including the travels expenses and the flight tickets. The OAT is around 400 pounds. The visa, the skilled worker visa, it costs around 250. Flights 500, accommodation 600. So with those, I mean the expenses that you need before you get your first salary from the UK, and after that you will accommodate your life depends on your salary. Just brief about the visa. If you are applying through the skilled worker visa, you after 5 years you will be eligible to apply for the ILR, and after 1 year from the ILR you will be able to get the citizenship. But the Tier 5 visa, you will not be able to apply through the ILR because you are not eligible for that. Regarding the BMA, which is the British Medical Association, it's a leading voice advocating for outstanding healthcare and healthy population. It's controversial whether some people they don't like to apply to it, or because it costs around. It depends.
360 to 400 pounds sometimes. Yes, quite expensive.
It's a bit expensive, but it does help you with if you have a problem with your trust, especially with your contract or salary. It does help, and it did help me to change my salary because I had a problem with my trust before. So sometimes it's worth to to follow them. It depends. And the ISCP, which is Intercollegiate Surgical Curriculum Program, it's an online portfolio. It costs around 260 a year, but I do advise anybody interested in surgery to apply to it. It's very helpful. It builds up your portfolio, and it's mandatory for the trainee and for anybody who want to apply to the CSER. It will be mandatory next year. The last thing, indemnify companies. Briefly, to protect against the failure, like it's like protect against the failure of exercise reasonable skills and care in the provision of healthcare services. So in general, your trust is responsible to cover your failure if you do any mistake, but there are certain limits to cover. So those companies, they can cover any extra cost you might need to pay if you had any problem. There's different companies like MDU, MDDUS. Many like doctors advise to apply for that if you are in the UK. And thank you.
Thank you very much. Thank you very much indeed, صالح. Thanks a lot. هي عبارة عن بالعربي تأمين لأخطاء في العمل. هذا ال MDU وال MDS. نتحرك إن شاء الله تعالى لبروفيسور لباني. آخر جلسة ختامها ومسك وأفضل ما عندنا إن شاء الله تعالى. بروف لباني بعد إذنك إذا حبيت تدخل معنا. بروفيسور سماني.
ماشي، سامعني وشايف السلايدز ولا لا؟
السلايد لسه مش شايفه بس انا سامع. السلايد اللي شايفه لسه السلايد تبعت دكتور رومان. دكتور رومان ممكن كان يستوب ذا شيرنج من عندك عشان ندخل للشيرنج الثاني؟
Yeah, stop.
اوكي. شير سكرين. كيف هلا؟
نعم, I can see yours. نعم.
Okay. It's been a fantastic session actually. The speakers have explained the process and the advantages and disadvantages of working in the UK.
تعلي صوتك بروف لو سمحت, الصوت شوية أعلى.
Okay, I'm saying the speakers have been fantastic and the talks have been brilliant in explaining the pros and cons of working in the UK. So I'm going to just focus on a couple of things. I will not take too much time and we will leave room for questions later on. Okay. So you've all seen similar slides talking about the medical training pathway in the UK. There are other specialties apart from OB/GYN and surgery that you can get involved in. Obviously, emergency medicine is very much required in the UK. And you enter that after foundation through ACCS pathway, and you do your emergency medicine pathway 4 years. Or medicine now is through IMT, where it's actually 3 years program rather than core medicine, which used to be 2 years program. And then you enter the medical specialty that you choose. Core anesthetics is also another option. And all these are either, as has been explained before, either run through training programs or uncoupled programs. There's another total different option, which is GP training in this country. In GP training, you enter it after foundation, and it is a 3 years training. And you actually end up being a fully qualified GP after 3 years of training following your foundation training. At the end of the training, you get CCT, Certificate of Completion of Training. Or for that's in general surgery or medicine, or as a GP. We've gone through the run through training programs. Once you are a trainee and you've been successful in being selected as a trainee, the way you progress is being judged against set criteria in your own curriculum. Different specialties have different curriculums, and they have specified milestones that you have to achieve to progress from one step to the next. The assessment is done through annual review of competence progression, or ARCP, and you can either progress to the next year, have additional training requirements, or have additional training time added to your time. And at the end of the training, if you achieve all your requirements, including your specialty examinations, the trainee is signed off, which is an outcome 6. and the trainee can then apply for CCT and to apply to go on the specialist register. The exams for surgery is MRCS and then followed by FRCS of your specialty. So FRCS cardiothoracic, FRCS orthopedics and trauma and orthopedics, whatever, at the end of your training. In medical specialties, it's MRCP. All the other specialties have their own exams, and anesthesia, emergency medicine, all of the other specialty, and GP, radiology, they all have their own exit exams. And we've heard about the Obzangani exam that you need to achieve before you are signed off and get your CCT. But I just want to warn you here that this is an example of cardiothoracic exam that we held last October. So if you look at the total number of people that sat the exam, it was 21. The overall pass rate was 67%. NTNs are national trainees who are in a training program who have a national training number. There was 9 of them and 100% passed. But non-trainees, people who are not in a training program, only 42% of them passed. So there is a big discrepancy in the UK between exam pass rates between trainees and non-trainees. It could be due to poor preparation, not being familiar with the exams or whatever, but exam rates, success rates are lower for international medical graduates in general and for non-trainees in general. And you need to be a little more prepared for that. That's all I'm gonna talk about the training and for now. I just want to mention academic training pathway. You've seen the medical training pathways in the UK, but there's also an academic training pathway. And if somebody is interested in becoming an academic, there is a laid out pathway that you could follow. So in medical school, a lot of the students do intercalated BSc or MSc, Masters or Bachelor of Science, or some of them even do a postgraduate degree, MD or PhD. And then there is academic foundation programs that you can apply for. And following the academic foundation programs, you can, which gives you actually 4 months of pure research that you can just dedicate to doing research out of the 2 years. After that, you could apply for academic clinical fellowships, which is a 3 years program that replaces your core medicine or core surgery training. And then when you get into higher training at ST3 level, you can apply for a clinical lecturer post as well, which is a 4-year program, allows you 50% to do research, 50% to do clinical work. And this qualifies you to hopefully in the future be able to apply for a senior clinical, senior lecturer post and professor within this country. If you want to get involved in research as a trainee, there is loads and loads of collaboratives now with every specialty you can think of. And we're all aware of Global Surge. A lot of people contributed to the COVID Surge programs and got publications out of it and presentations, and it's been very successful. But whatever specialty you're in, there is a trainees collaborative that you can join, you can become part of, help you establish your academic credentials, publications, and presentations. The end of training is to become to go on the specialist register, and in the specialist register entry is essential for you to work as a consultant or a GP in this country. And how do you become? How can you get onto the specialist register? We've heard it before. You either complete a recognized training program within the UK by the GMC, and you get a formal CCT, or you can go through the CSER route, Certificate of Eligibility for Specialist Registration. There is an equivalent part for GP trainees. The Certificate of Eligibility for Specialist Registration, you apply for that, and you have to demonstrate that you have all the competencies equivalent to a CCT holder or somebody who has finished training. You apply on the GMC website. The application then is forwarded to the relevant Royal College or the SAC, I, as a SCC member of cardiothoracic surgery, I review the CSER applications. I look at them against the curriculum and whether they can demonstrate the same competencies or not, and whether they're successful or not. And then the evidence we look at when we're assessing a CSER application is for the last 5 years of your practice, nothing before that. So the last 5 years, but this means that anybody who is thinking about going through the CSER route or not through a training route need to be gathering the evidence as they go along for the last 5 years, not to come on the day that you want to apply and then start thinking about getting the evidence. You won't be able to get that evidence. So as advised before, register on ISCP. You can build up your work-based assessments, your teaching assessments, or everything on ISCP, and that will be used as evidence for you for the last 5 years. Participate in audits and quality improvement projects, teaching, research, all of that is assessed when you apply for a CSER application. And it is focused on 4 domains: knowledge and skills, performance, which is the biggest bulk of the application, accounts for about 75% of the application. And that you have to show that you've enough knowledge, enough skills, and you can perform to the level of a day 1 consultant in the UK or a day 1 GP in the UK. There are other issues, other domains that you have to provide evidence with in, like safety and quality, communication, partnership, teamwork, and maintaining trust with the patients and your colleagues. This is just to give you an example of cardiothoracic applications. For example, over the last 11 years, we had 73 applications, for example, and 56 of these were awarded. So on average, we award 5 CSER applications every year, out of 7 or 8 being applied every year. So the success rate is high, but the time period can take up to 3 to 4 years for the process to be completed. And that is because people don't provide the evidence to start with in the beginning, or they haven't been collecting the evidence appropriately as they went along. And then they're sent back to get some more evidence, and that takes them 2 to 3 years to get further evidence. So if you are thinking about doing a non-training post and going through the CSER route, you need to collect evidence for the 5 years before you apply. So think about it ahead and plan ahead. Just a few points that I wanted to raise. I don't want to go in any more detail. Thank you very much for the opportunity, Hussam, and we'll be happy to join you all in the discussion.
Thank you very much indeed. Can I invite the panel to close their cameras and let us see them? We have a couple of questions, and if there is any more question, please feel free to forward it. The first question is from Hashim Al-Dujaili. He's asking, how can he apply for FY2 if he's going to do the BLAB test after graduation, and then by the time he finishes BLAB test, the application for FY1 would have finished? Can he apply for FY2? I think this is what I understood from his question. I suspect as a BLAB test, you don't have to finish your medical degree to submit the exam, to sit the exam. I'm not sure what you guys know. Ashanti, if you're around. And Dr. Rahman.
As far as I know, you have to complete FY1 to go to FY2, though you wouldn't be able to go to FY2. But I know lots of trust grade doctors who just did a trust grade job in F1 and didn't do their F2. They just did a trust grade job as F1, and then they applied for specialty training. Does that make sense?
Yes, but that will depend on your previous experience. You have to have previous experience equivalent. There are some countries in Europe which do a 6 years medical degree. So the 6th year in their medical degree is counted as F1 year here. So they come into FY2. They don't need to do FY1. They come in already to the country with full registration rather than provisional registration, which is the FY1 registration. So there are ways around it, but I think it's always good if you are new to the country and you haven't been in the UK system and you're junior enough to do an Why 2 year? Because it gives you a lot of exposure to the NHS, a lot of exposure to the UK system, and sets you up for future applications. And it's very easy to get somebody then to sign you off your certificate of the equivalent certificate of completion of foundation. I've done it for a few people, and they have to demonstrate that they have all the competencies of F1 and F2. So you need a year sometimes to really see somebody and observe all these competencies to be able to sign them off with an equivalent certificate of completion of foundation training.
So
just again, yeah, that the form that Mr. Lubani, it's called the CRIST form, and most of almost all of Jordanian doctors who came to the UK, they get it signed from Jordan that you have finished the foundation years back home, and it's applicable. Just you just need to show them that form. It's called the CRIST form, CREST. It's on Google. You can find it on Google.
Mm-hmm. I understand. This form is straightforward. If you know anybody, a consultant, especially if he's trained in the UK, especially if they are on the GIMS register, that will make your life much easier. And there are plenty of consultants working in the Middle East who are on the GIMS register who can sign these forms for you. However, spending a year in the UK before you apply for specialty training is very useful. So you can do this as you can bring the CRIST form with you, so you are not bound to it, but you still will be useful in order to get some references and experience of the working pattern in the UK. Now, the other question he was asking is, do you recommend 1 or 2 years of non-training jobs to get to know the system before getting into training? I think 1 year will be enough for non-training jobs if you can, if you're ready. Having said that, from my point of view, you need time to prepare. If you started preparing during medical school and during your internship overseas, maybe 1 year will be enough. If not, then you probably need 2 years. What do you think, Professor Lubani?
I agree with you. Minimum of 1 year, potentially 2 years. There's another thing we didn't mention, which is clinical attachments. I've had quite a few people who did clinical attachments with me, and they spent few months with us. And from that, they actually got jobs. So it is another route that some people can use if they're applying for jobs and they're not getting a job, to try and find a trust that has clinical attachment system. And you do a clinical, it is unpaid, but it gives you some experience, allows you to build some relations, some references within the UK. And then from that clinical attachment, sometimes you can get a paid job.
A question to you, Katie, how long does it take you to prepare audits and presentations? So if you're working on audits and trying to achieve the maximum number, as in the publication or the 5 presentation and 8 audits, is it that number? How much time do you need to dedicate for getting the maximum number in your portfolio?
Well, how long it takes to complete an audit very much depends on the audit. So I did mine very quickly. So my audit that I used to apply, that was my evidence, my core surgical training, I audited the information that we were putting on trauma CT requests and saw if it was complying with the Royal College of Radiology guidelines. So I looked at trauma calls for a month, so that was 60 patients. That's not much data really to look at. So I managed to do that data collection in a day. I put the data together, presented it locally, and at my kind of local M&M monthly surgical meeting, and then I re-audited it. I had to wait a month for the next lot of trauma calls to come through. And again, it took a day for me to analyze the data. And that was my closed loop audit, done and signed off, maximum points for that. So you've just got to be a bit savvy about the kind of audit you get involved with, because I think a lot of the time people can be like, oh yeah, come and do this data collection for me. And there's like 1,000 patients and you'll never get a chance to present the audit or
so it takes about a month, 2 months, 3 months?
I think you can do it within a month or two. Really, as Katie was saying, you have to be selective and you have to be opportunistic and you have to be strategic when you're doing an audit. You have to be clever about it. So don't get involved in audits that will take you ages. Just get a quick audit that you can turn around very quickly and that you can re-audit.
Professor Lubani, just in a nutshell, what's the difference between an audit and a research? Because audit is a very much UK thing.
Yeah, audit is basically you're looking at your current practice against standards or guidelines. However, research, you're trying to generate new knowledge, new information. So there's a big difference. Audit, normally you go through approvals through a clinical governance department within, or a clinical audit department within the organization, within the trust. But for research, you will need to get ethical approval, and that is done through the integrated research ethics approval platform, which is a web-based application form. So there's a huge difference between the two.
So, Dr.
One
Saleh,
thing I would say is, oh, sorry, it's just I was at the ASIC conference recently, and a great thing to do to look for quick, easy audit ideas is to be going to conferences, looking at posters and thinking, oh, that looks quick and easy, and that's relevant to my trust. I could very easily do that in my trust. So going to conferences, looking at other people's posters, that's a really great way to get some ideas.
Do you have, Saleh, is there plenty of opportunities to do audits or research in Jordan, for example, in the hospitals you worked in?
It's like because most of the people there, they don't have any previous experience in research or audit, so it's been a bit difficult. Not because the resources, because the people, most of them, like, they don't have any previous experience, and they focus on the work rather than do any like quality improvement projects. But we did a couple, but in here it's more I mean, in the UK it's very easy to get the things done very quickly as well. But it's not difficult though to have audits or research like in our Middle East countries.
So the next question is about Mu'taz Toom. What are the chances to get a job for urology at ST3 level? And I think Prof. Lubani, what do you think?
To get a urology job?
ST3 level, a training job. I suspect he's asking about the training job at ST3 level.
Yeah, so I am not familiar with the competition ratio for urology specifically, but there are specialties that have and what I mean by competition ratio is the number of applicants versus the number of training jobs. So for example, I'm aware of cardiothoracic surgery, it's 15-1, but in core surgery, it will be a lot less, it will be 2-1 or 3-1 maybe. I'm not aware of the urology of one, but you can look it up about the competition ratio for urology or the other specialties if you're interested in. And the lower the competition ratio, the better the chances are for getting a job.
From my perspective, to look for ST3 training jobs, you need a year to 2 years to prepare for into the ST3 training job. There are certain requirements. Look at the requirement 2 years before you start thinking. So you finish medical school, you want a training in the UK, or you want to go into training number. There's nothing to stop you from applying. All what you need is to look at the application platform, look at the requirement for the training, start preparing early. By the time you apply, you are ready to come either as ST3 already, or you're ready to come as in a prestigious, a really good placement, which might not be designed for training, but can give you good training to prepare you for a urology job. So that's my advice. And the chances, you do have a chance if you tick all the boxes.
Hussam, can I make a
yes, Dr. Shanti, can you show yourself?
Yeah, so I personally was in urology for 2 years, and when I got my core surgical training offer, I got the core surgical training offer, but I didn't get the urology anesthesia training. So, and I switched back to Obs-Gynae. This is my story because I didn't want to go for ST3 urology. ST3 urology is not just simply you get the MRCS, you get a few audits, and that's it. So as any ST3 application for surgery, you need to get a very well-established logbook with a certain numbers of operation being verified by consultant. I don't want to make it hard, but it's really, really important to have a look at the personal certifications and the numbers you need to get for each operation before you go for ST3.
So yeah, so it is doable, but you need to plan it in advance. You can't plan it the night of application, closing date of application. The next question is, are there any templates for evidence required for CSER specific to each specialty?
Yes, there is. If you look at the GMC website, it actually gives you all the requirements per specialty. So there is the CSER website on the GMC website, CSER page, I'm sorry, on GMC website, and there is a link to every specialty and gives you the requirements for every specialty. And you have to go through it very carefully and submit and gather the evidence. So if you're thinking about applying in 2 to 3 years time, now is the time to start gathering the evidence, not in 2 to 3 years time when you're applying.
Question from Lana Habaib. Is there any tips or recommendations regarding applying for non-training jobs? How can I improve my CV? And the panel, Saleh, what do you think?
It's the same. For like, you have to build up your portfolio audits, research if possible, and to have previous experience in your field that you are interested. And as Mr. Lubani said, if you have a clinical attachment from that subspecialty, that will be very, very helpful.
Ahmed, do you have any idea? Ahmed, Prof. Lubani, any comments?
I mean, exactly as you said, to make yourself competitive for any job, you have to tick all the boxes. One of the boxes is clinical experience and skills and surgical experience, but there are other boxes when you're applying for a job, including audit, quality improvement, presentations, publications, teaching, leadership, management. All of these areas you need to be working on and to develop yourself in all of these areas and be able to provide evidence of achievement and competence in all of these areas. And that's what is going to make you competitive. That's what's going to make you stand out. And that's what's going to give you the next job.
From my perspective, the only thing I would say, you can enter the system at any bracket point. It's not an issue. But the more you've achieved overseas, the less you'll do here. So if you finish your MRCS, you finish your FRCS exam, you finish your training overseas, you will be aiming for a fellowship training here, which some of them can be training jobs, some of them can be non-training jobs. You are likely to get more for your bucks or more for your move than coming early in your career. That doesn't mean don't come early, but you can always anticipate your steps. So MRCS exam, you can do part 1 when you are doing your internship. That's the best time for it, the best success time for it, because you've just finished medical school. Part B, you can do it as soon as you start your training, okay? Because that will help you build up that kind of knowledge base quickly before you start practicing. So there is time frame for everyone, and it's ahead of what you think. If you have finished your MRCS exam, you will be applying for a registrar job, for your senior CHO or registrar job. If you finish your FRCS exam, then you will be coming for a post-CCT fellowship or a fellowship equivalent to that level. Depends what level you are.
Can I pick up a couple of questions? Can medical students apply for the e-logbook for surgical specialty? Yes, you can. You can register and have an e-logbook. And there was another question about multi-center audit. Yes, you can do multi-center audits. It has to be registered as an audit in each of the centers, but one center can be the lead on that. There's very good examples of that, and they're usually easily published because you get large numbers from a lot of centers.
Is doing BLAB to have GMC registration, then apply for MRCP, for example, would increase the chances to get ST3 or not worth the extra effort comparing with doing the only MRCP with 2 years experience? I don't think it doesn't make any difference. It's just more effort, more money for no reason. What do you think, guys? Any ideas? Doing BLAB and doing MRCP at the same time. Will it make any difference?
No, I mean, if you have the MRCP or MRCS, that exempts you from the PLAB. So why do the PLAB? So either do this or the other one. I think you don't need to do both. You don't need to do both.
Can we apply same audit methodology for multiple hospitals and publish them separately? Yes, you can.
Yeah, we answered that question.
We do have research collaborative, and we are in the UK. And I don't think there should be any reason why Palestinians or people from the Middle East cannot join these collaborative from their own accord. They can. You just need to get in touch with them. Is there any other button? Can medical students apply for? You've answered this question already. I think is there any from within the panel? Is there anything you think might be useful for others to know?
It's the main thing, like we've all been saying throughout all of it. If you have your goals in mind, have the person's speciality, have the application form in front of you, know what you need early on, and then you can start ticking things off early. Yeah, that was the main thing I'd say.
Yeah. There are specific days for applying for presentations, and it's really easy to get a presentation through. It's not difficult, and you can. Some conferences will allow presenting remotely. Even you don't need to come physically to do that. Don't you think, Katie? The presentation facilities be able to apply to online conferences to apply for your presentations and audit study, so you can present them. Can you apply for submit to conferences online to present things?
Yeah. I don't know if Katie is going to answer this, but yes, you can. There are a lot of conferences now that are being done online, virtual conferences, and you can present. You can submit to them from anywhere in the world, and you can present from anywhere in the world. So it's made it easier for people to submit and present who are not in the country. So yes, you can.
How can we get in touch with doctors doing audits in the UK? Can we conduct it with them via your institution? You don't have to conduct it via our institution. You can. There are various research groups. A London research group, the Midlands research group, the Rose research group. You have some research group we are aware of, Professor?
Yeah, I put the slide, if you remember. They can look it up. There's loads of collaboratives. The White Rose one, West Midlands, is mentioned in there, so they can get in touch with them and collaborate with them on international projects easily.
We are in the process of going for the academy, hopefully at some point, and hopefully some of our projects is doing some research collaborative locally, build it up. Would you like to give some talk, a few words about this, Professor Libani?
Yeah, absolutely. I mean, our PALMED Academy is being established at the moment, and part of it will be, one of the pillars of it will be to encourage and support clinical audit, quality improvement projects and research, as well as courses for clinical courses and training and facilitating MTIs and fellowships and all of that. But so do keep in touch with the PALMED and PALMED Academy, and hopefully in next year there'll be a lot more information coming through.
A final question. My question regarding the postgraduate certificate in medical education, as it counts as 2 points in self-assessment. Any online modules that end with such certificate known by the panel? Yes, you have the Cardiff University, the Edinburgh University, they both have online modules. You can join them online. There are a lot of universities that do online teaching for postgraduate certificate. However, if you have the time, I would recommend you going for the master's rather than a certificate. If you have the time and the fund, that will count better, and it will give you that continuity of projects. I think we're approaching. We finished the time. It's 7:38 now. Is there any comments from anybody? Any comments from anyone before we go? Regarding the university, we can send that separately. I think I'll write it down. Any other additional comments before we wrap up?
Thank you very much, Hassan, for organizing this, and thanks for the panel for excellent talks, and for the participants and thanks to the participants for their active participation, even after the World Cup drama.
Well, congratulations for Argentina.
They deserve to win it anyway, so it was fine.